Welcome back. This is Volume 1, Chapter 15, Airway Management and Ventilation. The standard is airway management, respiration, and artificial ventilation. This is a four-part series. We are going to integrate comprehensive knowledge of anatomy, physiology, and pathophysiology into the assessment to develop and implement a treatment plan with the goal of ensuring a patent airway, adequate mechanical ventilation, and respiration for all patients of all ages. Airway management and ventilation, first and foremost, are critical steps in a primary assessment of every patient. We need to establish and maintain an open airway while providing adequate oxygenation. And I might add to that, establish and maintain an open, secure airway while providing adequate oxygen. Without adequate airway maintenance and ventilation, the patient will succumb to brain injury or death in as little as 4 minutes. We'll be here seeing multiple acronyms. ABC, we're all familiar with, is airway, breathing, circulation. CAB, compressions, airway, breathing. You also may see this as CAB as circulation, airway, and breathing in trauma situations, which we will cover later. We need to know that we cannot assess an airway if the patient is not breathing. So if they're not breathing, we need to breathe for them so that we can listen to lung sounds, so that we can perform that assessment that we would normally do on a normal, alert, conscious patient. We cannot assess breathing if there is no airway. So if we can't get air into that airway, we cannot fully assess that airway. So we need to make so they can breathe. So airway and breathing are happening at the same time. Airway and ventilation are considered and managed together. So breathing and ventilation go hand in hand. If they are not ventilating or we are not ventilating for them, we cannot assess that airway. If we cannot breathe for them or they cannot breathe for themselves, we cannot assess their breathing. Circulation depends on an intact airway, adequate ventilation, and respiration. In short, that means if they're not breathing and they don't have an airway, there's no oxygen getting in, and without oxygen, the heart can't beat. So it will use up what oxygen it has left in the bloodstream until it can't anymore, and then it will eventually get irritated, go into arrhythmias, and ultimately stop. Airway and ventilation problems must be approached in a nonlinear fashion. You have to be flexible. You have to be able to maneuver with those two things at the same time. Simple, basic airway skills are the key to a successful airway management. We do not always need to jump straight to intubation on a patient that's not breathing. Many can be adequately maintained with a bag mask and qualified partners or emergency medical personnel as well. Does not always have to be, and it's a advanced skill. And we need to continually monitor and reassess that airway. Once we identify a problem, especially, we need to reassess to make sure that that problem is not, and we have fixed the problem. We need to reassess to make sure the problem is in fact fixed and they are improving and the airway is secure. We also need to make sure that the problem is not reoccurring or another problem is not emerging.